There is a habit that more than half of all adults over 60 perform within the first 20 minutes of waking up. It feels harmless. It feels normal. For many people, it has been part of every single morning for 30 or 40 years. And according to what we now understand about how the cardiovascular system behaves in the hours immediately after waking, that habit may be doing more to drive elevated blood pressure readings throughout the day than the salt on their dinner plate, the stress of their afternoon, or the extra weight they have been meaning to address. What makes this particularly important is that most people taking blood pressure medication after 60 do not realize that the medication is fighting against something happening at the very start of the day. The pill is doing its job. The morning habit is undoing part of it. And because the habit happens before the blood pressure is usually checked, the connection never gets made. I'm Dr. James Whitfield, cardiologist, and what I want to walk you through today is not a list of generic lifestyle advice you have heard before. It is a precise, mechanistic explanation of why the early morning hours are the most dangerous window of the day for cardiovascular events in adults over 60. What one specific morning behavior dramatically amplifies that danger, and what the research now shows about how quickly that risk can be reduced once the behavior is understood and addressed. By the end of this, you will also understand exactly which products, which alternatives, and which morning adjustments make the most meaningful difference, not in theory, but in the actual blood pressure numbers recorded across the day. Let me start with Gerald, because his situation is one I have seen repeated with remarkable consistency across patients who come in convinced that their medication is underperforming. Gerald was 66 and had been on a combination of amlodipine and losartan for 3 years. His evening blood pressure readings, taken consistently after dinner, ran beautifully. His cardiologist was satisfied, but Gerald had started taking his own morning readings after purchasing an Omron Platinum upper arm blood pressure monitor from his local pharmacy, and what he saw alarmed him. His morning numbers, taken within 30 minutes of waking, were consistently 18 to 22 points higher systolic than his evening numbers. He was certain his medication was failing him overnight. He asked about a stronger dose. He asked about adding a third drug. What nobody had yet asked him was what he did in the first 15 minutes after getting out of bed. Gerald's answer was the same as millions of people his age. He walked to the kitchen, switched on the coffee maker, and drank a strong cup of black coffee before doing anything else. He had done it every morning since his early 30s. It was not something he thought of as a choice. It was simply the beginning of the day. The habit is caffeine. Specifically, the high-dose, rapid caffeine intake that most older adults consume through coffee first thing in the morning on a system that is already in the most cardiovascularly vulnerable state it enters in any 24-hour period. Here is the mechanism, explained precisely enough to be useful. In the hours before waking, the body begins preparing for activity. Cortisol levels rise sharply, a process called the cortisol awakening response, which peaks within 30 to 45 minutes of waking. Simultaneously, the sympathetic nervous system, which governs the fight or flight stress response, increases its activity. Adrenaline, which is also called epinephrine, begins rising. Heart rate increases. Blood vessels begin to tighten. Blood pressure climbs. This is not pathology. This is the body's entirely normal mechanism for transitioning from the low-demand state of sleep to the physical and cognitive demands of being awake and mobile. It is called the morning blood pressure surge, and it is a well-documented, well-studied phenomenon in cardiovascular medicine. The morning blood pressure surge in healthy younger adults is modest and self-limiting. The vessels tighten, pressure rises briefly, and the system normalizes within an hour or so as cortisol peaks and the parasympathetic system restores balance. In adults over 60, particularly those with existing hypertension, the morning surge is both larger in magnitude and slower to resolve. The blood vessels of older adults are less elastic, which means the tightening produces a steeper pressure increase for the same hormonal stimulus. The cortisol awakening response is also altered in older adults, often peaking higher and taking longer to normalize. The result is that the window of elevated cardiovascular risk in the morning hours is wider, steeper, and more consequential in the population over 60 than in any other age group. This is not a theoretical concern. The majority of heart attacks, strokes, and sudden cardiac deaths occur between 6 in the morning and noon. The morning blood pressure surge is one of the primary explanations for that distribution. Now add caffeine to that picture. Caffeine works by blocking adenosine receptors in the brain and throughout the body. Adenosine is a compound that accumulates during wakefulness and promotes the sensation of tiredness. When adenosine receptors are blocked, alertness increases. But adenosine also performs a vasodilatory function, meaning it helps keep blood vessels relaxed. When caffeine blocks adenosine receptors in the blood vessels, those vessels tighten. Adrenaline release is also amplified. Heart rate increases. The net cardiovascular effect of caffeine, particularly in the first 30 to 60 minutes after consumption, is a measurable acute rise in both systolic and diastolic blood pressure. In a person who consumes caffeine at 2 in the afternoon, when the cortisol awakening response has long since normalized and the sympathetic nervous system has settled into a baseline state, the blood pressure elevation produced by caffeine is typically modest, short-lived, and clinically insignificant for most people. In a person over 60 who consumes caffeine within the first 15 to 20 minutes of waking, when cortisol is surging, adrenaline is already elevated, and the morning blood pressure surge is actively in progress, the caffeine effect does not add to the background. It multiplies it. Two independent vasoconstrictive and sympathomimetic forces are acting simultaneously. The result is a morning blood pressure spike that, in susceptible older adults, can be clinically significant and, in some patients, dangerous. Research published in the American Journal of Clinical Nutrition demonstrated that caffeine consumption during the cortisol awakening response window produced substantially greater cardiovascular responses than the same caffeine dose consumed later in the day. Studies examining morning blood pressure in hypertensive older adults have consistently shown that early morning caffeine consumption is one of the modifiable behavioral factors most strongly correlated with elevated daytime blood pressure measurements. This is what Gerald was experiencing. His medication was performing appropriately for the physiological baseline it was designed to manage. What it was not designed to override was the additional sympathetic load he was adding to an already surging cardiovascular system every single morning, before the medication had even begun its peak activity for the day. Margaret was 69 and came to see me after 3 months of increasing anxiety about her blood pressure numbers. She had been keeping a detailed log, which I genuinely appreciated, and she had noticed that her highest readings of the day consistently occurred between 7 and 9 in the morning. She was on lisinopril and had reduced her sodium intake significantly. She exercised 3 afternoons a week. Her diet was, by any reasonable standard, excellent. What her log also showed, though she had not made the connection, was that she noted her morning coffee time alongside her readings, and the correlation between an early coffee and a high reading was visible in her own data once someone looked for it. Margaret drank 2 cups of strong coffee, specifically Folgers Classic Roast, prepared in a standard drip machine every morning between 6:30 and 7. Each cup delivered approximately 100 to 150 milligrams of caffeine, putting her total morning caffeine intake between 200 and 300 milligrams consumed during the peak of her cortisol awakening response. Her blood pressure taken before coffee averaged 128/81. Her blood pressure taken 40 minutes after her second cup averaged 147/88. That 19-point systolic difference was not her medication failing. It was her morning habit working directly against it. The intervention we discussed was not to eliminate coffee from Margaret's life, because for many older adults, the recommendation to stop drinking coffee entirely is one that produces zero compliance, and zero compliance produces zero benefit. The intervention was strategic delay. The cortisol awakening response, which drives the morning blood pressure surge, peaks within 30 to 45 minutes of waking and begins declining meaningfully after that point. By 90 minutes after waking, in most adults, the cortisol surge has substantially resolved. The sympathetic activation associated with the morning transition has settled. The blood pressure surge, if it has not been amplified, is normalizing on its own. This is the window that matters. Consuming caffeine 90 minutes after waking, rather than within the first 20 minutes, removes the overlap between the cortisol surge and the caffeine-driven adrenergic effect. The same coffee, the same amount, the same strength, but timed to a moment when the cardiovascular system is no longer in its most vulnerable and reactive state, produces a substantially smaller blood pressure impact. Andrew Huberman, the Stanford neuroscientist whose work on circadian biology and the cortisol awakening response reached a wide audience, has discussed this principle extensively in the context of alertness and energy management. The cardiovascular application of the same principle is directly relevant to older adults on blood pressure therapy, and it is one of the most practically actionable pieces of guidance I share with patients in this demographic. Margaret implemented the delay. She began waiting 90 minutes after waking before her first cup, which meant switching her coffee time from 6:30 to approximately 8. She continued drinking the same Folgers Classic Roast, the same 2 cups, the same preparation method. At her 6-week follow-up, her morning blood pressure readings had dropped by an average of 14 points systolic and 8 points diastolic. Her medication had not changed. Her diet had not changed. One timing adjustment to one existing habit had produced a result that a year of sodium reduction had not fully achieved. Now, I want to address the complexity within this recommendation, because it is not simply a case of delaying coffee and solving the problem for everyone. There are several additional morning habits that either amplify or interact with the caffeine surge combination in ways that older adults are almost never told about. The first is the use of pre-workout supplements and energy drinks. Products such as Celsius, marketed heavily as a fitness and health beverage and widely available at Walmart, Target, and Costco, contain between 200 and 270 milligrams of caffeine per can, comparable to 3 cups of coffee. C4 Energy, another widely available product, contains 200 milligrams per can alongside additional stimulant compounds, including beta-alanine and B vitamin complexes that amplify sympathetic nervous system activity. These products are increasingly consumed by health-conscious adults over 60 who associate them with active aging and cardiovascular fitness. Consumed in the morning during the cortisol surge window, they produce a blood pressure spike that is substantially larger than coffee alone, and that persists longer given the additional stimulant compounds. If you use any energy drink, pre-workout powder, or thermogenic supplement in the morning, the same 90-minute delay principle applies, and the total stimulant load warrants a direct conversation with your cardiologist before continuation. The second additional factor is the combination of morning caffeine with immediate physical exertion. Walking, cycling, or any aerobic activity performed in the first 30 minutes after waking is itself a sympathomimetic stimulus. The body interprets physical demand as a signal to further increase heart rate and vascular tone. Exercise first thing in the morning is not harmful in the context of well-managed blood pressure when performed with appropriate warm-up and at moderate intensity. But exercise combined with caffeine consumed during the cortisol surge window creates a third simultaneous source of sympathetic activation stacked on top of 2 that are already present. For older adults with poorly controlled morning blood pressure, this triple stacking is the precise scenario most associated with early morning cardiac events. The sequencing that most protects the cardiovascular system is this: wake, hydrate with water, allow 90 minutes before caffeine, begin light movement after 15 to 20 minutes of waking if desired, and reserve moderate to vigorous exercise for after the caffeine delay window has passed and the cortisol surge has resolved. The third factor is the interaction between morning caffeine timing and blood pressure medication timing. Most blood pressure medications are prescribed without detailed guidance about the optimal time of day to take them relative to the morning surge. For medications like amlodipine and losartan, which have long half-lives and are taken once daily, the timing flexibility is greater. But for shorter-acting medications or combination therapies, the pharmacological peak of the medication may not coincide with the peak of the morning surge if the medication is taken in the evening or at a time that leaves a trough in the early morning hours. This is called the morning blood pressure trough problem, and it is one of the primary reasons some cardiologists now recommend that certain antihypertensive medications be taken at bedtime rather than in the morning. A landmark study called the Hygia chronotherapy trial, published in the European Heart Journal, found that bedtime dosing of antihypertensive medication reduced cardiovascular events significantly compared to morning dosing, with the proposed mechanism being precisely this alignment of medication peak activity with the early morning surge window. Whether bedtime dosing is appropriate depends on the specific medication and the specific patient, but it is a conversation that every senior with poorly controlled morning blood pressure should have with their prescribing physician, particularly if morning caffeine delay alone does not produce the expected improvement. Let me bring this together through Gerald's outcome because his story deserves its ending. Gerald implemented 3 changes following our conversation. He delayed his morning coffee from immediately on waking to 90 minutes after waking. He switched from his standard preparation of 2 strong cups of 8 o'clock coffee, a brand he had used for years and which delivers approximately 130 milligrams of caffeine per cup, to a single cup of the same brand prepared at half strength for the first month to allow his system to recalibrate without the behavioral disruption of eliminating coffee entirely. And he moved his amlodipine dose from morning to bedtime following a discussion about his specific medication profile. At his 8-week follow-up, his morning blood pressure readings had dropped from an average of 158/94 to an average of 134/82. His evening readings remained stable. His cardiologist did not add a third medication. Gerald did not need a stronger dose. He needed to understand what the first 20 minutes of his day were doing to a cardiovascular system that at 66 no longer had the physiological buffer to absorb 3 simultaneous sympathetic stressors before breakfast. The practical framework I want you to carry out of this video is straightforward. The moment you open your eyes in the morning, your cardiovascular system is already under its greatest natural stress of the day. The cortisol awakening response is rising. The morning blood pressure surge is beginning. Adrenaline is climbing. Everything that happens in the first 30 to 45 minutes of waking either adds to that stress or allows it to resolve naturally. Coffee, energy drinks, pre-workout supplements, and immediate vigorous exercise all add to it. Hydration with water, light movement, and the patience to wait 90 minutes before caffeine all allow it to resolve. This is not a permanent prohibition on the things you enjoy. It is a timing adjustment that costs nothing, requires no prescription, and in patient after patient produces blood pressure improvements that months of dietary modification did not. If you take blood pressure medication and your morning readings are consistently higher than your afternoon or evening readings, the first question to investigate is not whether your medication needs adjustment. The first question is what you are doing in the 15 minutes after you wake up, and whether those habits were designed with any awareness of the cardiovascular window they are falling into. They almost certainly were not. Now you have that awareness, and that is precisely the kind of knowledge that changes what happens at your next cardiology appointment, and what happens every morning for the rest of your life.